This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is splicing of pre-mRNA? Answer: Splicing of pre-mRNA is the process by which precursor mRNA is transformed into mature mRNA. Question: What is the typical beginning and end of introns? Answer: Introns typically begin with GU and end with AG. Question: How can alterations in snRNP assembly affect clinical disease? Answer: Alterations in snRNP assembly can cause clinical disease, such as in spinal muscular atrophy, where snRNP assembly is affected due to a decrease in SMN protein leading to congenital degeneration of anterior horns of spinal cord, which leads to symmetric weakness. Question: What are snRNPs? Answer: snRNPs are snRNA-bound proteins to form a spliceosome that cleaves pre-mRNA. Question: What are anti-U1 snRNP antibodies associated with? Answer: Anti-U1 snRNP antibodies are associated with SLE, mixed connective tissue disease, and other rheumatic diseases. Question: Can you explain what is the role of snRNP in the splicing process? Answer: snRNP plays a crucial role in the splicing process by forming a spliceosome that cleaves pre-mRNA and removing introns to produce mature mRNA. Question: Why is SMN protein important in snRNP assembly? Answer: SMN protein is important in snRNP assembly because a decrease in SMN protein levels can lead to alterations in snRNP assembly, which can cause clinical diseases such as spinal muscular atrophy, a congenital degeneration of anterior horns of spinal cord that leads to symmetric weakness. Question: Can you give an example of a disease caused by a problem in snRNP assembly? Answer: One example of a disease caused by a problem in snRNP assembly is spinal muscular atrophy, where a decrease in SMN protein levels leads to alterations in snRNP assembly, resulting in congenital degeneration of anterior horns of spinal cord and symmetric weakness. Question: What is the function of anti-U1 snRNP antibodies? Answer: Anti-U1 snRNP antibodies are a type of autoantibodies that target the U1 snRNP complex, which is involved in the splicing process. Elevated levels of these antibodies have been associated with autoimmune diseases such as SLE, mixed connective tissue disease, and other rheumatic diseases. Question: How can snRNP assembly be affected by SMN protein? Answer: snRNP assembly can be affected by SMN protein levels because SMN protein is important for the formation of the snRNP complex. A decrease in SMN protein levels can lead to alterations in snRNP assembly and affect the splicing process. Question: How does the alteration in snRNP assembly affect the splicing process? Answer: Alterations in snRNP assembly can affect the splicing process by altering the formation of the spliceosome, the complex that cleaves pre-mRNA and removes introns to produce mature mRNA. This can lead to abnormal splicing and the production of non-functional or harmful mRNA. Question: How can the alteration in snRNP assembly lead to the congenital degeneration of anterior horns of spinal cord? Answer: The alteration in snRNP assembly can lead to the congenital degeneration of anterior horns of spinal cord by affecting the normal splicing process of certain genes that are important for the development and function of the anterior horns. This can result in the production of non-functional or harmful mRNA, which can lead to the degeneration of the anterior horns. Question: How does a decrease in SMN protein lead to the symmetric weakness in spinal muscular atrophy? Answer: A decrease in SMN protein leads to the symmetric weakness in spinal muscular atrophy by affecting the normal formation of the snRNP complex, which is important for the splicing process. This can lead to abnormal splicing of certain genes that are important for the development and function of the muscles, resulting in symmetric weakness. Question: What is the relationship between snRNP and the autoimmune diseases SLE and mixed connective tissue disease? Answer: There is a relationship between snRNP and the autoimmune diseases SLE and mixed connective tissue disease in that elevated levels of anti-U1 snRNP antibodies, which target the U1 snRNP complex, have been associated with these autoimmune diseases. It is thought that these autoantibodies may play a role in the pathogenesis of these diseases by affecting the normal splicing process. Question: How does anti-U1 snRNP antibodies affect the splicing process? Answer: Anti-U1 U1 snRNP antibodies affect the splicing process by targeting the U1 snRNP complex, which is involved in the splicing process. Elevated levels of these autoantibodies can lead to the formation of immune complexes that can interfere with the normal splicing process, leading to abnormal splicing of certain genes and the production of non-functional or harmful mRNA.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the First Aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.